How a muscle functions, if it feels tight, will depend on the position of the joint. Position of the rib cage can impact how the shoulder blades move. This can impact shoulder flexion and how the arm moves in the joint. Looking at the pelvis, most people do not have control of the pelvis, so orientation forward or back lacks control. If the pelvis tips forward, that will close the angle in the hip. So upon flexion, you may have pinching. You may also lack internal rotation at the hip. If the resting position of the joint is reduced, your active range is going to be reduced. So if joint position changes, that will impact how all of those muscles around the joint will function. An example, if someone says to you, your glutes aren't firing. P.S. It's a load of baloney. The pelvis just might not be in the best position for the glutes to work optimally. So you could do all the strength work to activate a muscle as you want, and you could do all the flexibility work that you want. But if you don't look at the joint position first, all of that work will not have lasting change. So your starting point, if we can understand a joint position, what flexion, extension, rotation, all of that movement is, then we have a better understanding of a starting position of the joint.